on. 1 minute.
All right, we
7 o'clock.
live.
Good morning and welcome to Ask Endocrinologists. This is your place to get all your endocrinology questions answered. I am Dr. Hope and this is Dr. Grace, and we are endocrinologists. We've been doing our broadcasts with YouTube, Facebook, and Instagram sessions where we touched on different subjects, including weight loss, diabetes, osteoporosis, adrenal adenomas, thyroid disease. So please subscribe and look back at our previous broadcasts where we have details about those various subjects. So today we are going to be taking your specific questions on any endocrinology topic, and our purpose here is to really keep you informed, because the more you know, the better you are. So we are ready for your questions, and thank you so much for joining us today. Please put your questions in the chat. If you're on Facebook or YouTube, please put your questions in the chat and we'll be happy to join to answer your questions. So thank you so much again for joining us today.
Yes. Yeah, I'm so
So
happy
great.
that we have started the Ask Endocrinology live. It's a pleasant thing. Today is our first day starting live. So kindly bear with us if there are anything that is not in alignment as we should. We hope that we're going to get better as we proceed. Yes. So we are endocrinologists. If you are joining us for the first time, you are welcome. We are so glad that you are here. This is a podcast where we talk about your hormones. And, we all have hormones running in our blood, and it performs a lot of function. So many of the function is to control your blood sugar, is to control your sleeping pattern, your weight, your eating pattern, and many things, and even your reproductive pattern. So if you have any question, we are here. Drop your question in the comment below, and just say hi. You don't even need to put comment. Just say hi, I'm here. We want to know who are those people that are here with us today. So we are very happy to be here to see you.
Yep. And please let us know where you're joining us from. So say hello and let us know where you're joining from. So
Yes.
we'll have an idea of, who's watching. So, Grace, do you want to talk about some of the topics that we talked about in the past? So diabetes, right?
Yes.
Diabetes is so common. And the reason diabetes is common is because of obesity. Many people are overweight or obese, and because of that, there is a diabetes epidemic, not only in the United States, but throughout the world. More and more people are developing diabetes. So we can just talk about some of the ways to know that you are diabetic, or some of the ways to prevent diabetes. So the first thing is, just having a healthy weight. And how does that happen? Really with diet and exercise. So the things that increases your weight includes eating too much carbohydrates and sugars. So really work on keeping your sugars and carbohydrates down to a minimum. So I usually like to share with my patients the plate method.
Yeah.
What should your plate look like? Half your plate should be vegetables. I hope a lot of you like vegetables, but half your plate should be vegetables, and a quarter should be carbs, and a quarter protein. So a quarter of your plate should be like the rice or the pasta or potatoes, um, any other. Some people eat more ethnic foods like yuca, or other things that are high in carbohydrates. So that should encompass a quarter of your plate, and then the other quarter should be proteins. So proteins include different meats. Those of you who don't eat meat, then beans can serve as a source of protein as well. So we encourage you to have a healthy diet, control your portion sizes, and that will help you, to keep your weight down. The other thing for weight control is exercise, right? How much should we actually be exercising? Well, it is recommended that we should exercise at least most days a week. That means at least 4 days a week, 30 minutes of some type of aerobic exercise most days a week. That what kind of exercise? Some people say, "Oh, I don't like running." I personally love running. So I try to run. Um, and for those of you who actually watched our previous broadcast, I mentioned that I was training for the New York City Marathon. Um, it's going up and down, so I'm trying to keep up, but I definitely run. I am a Peloton user, so I actually been practicing with some of the Peloton programs. So running, but you can walk. You can walk 30 minutes of brisk walking, maybe 3 to 4 times a week, as we said. Or you can bike ride. Some people love to ride bikes, so you can ride your bike and get exercise in that way. You can use an elliptical machine, other types of exercise. So you should also do some weight training as well, weight exercises to help with toning. And that is important in your exercise regimen. So those are some of the ways to really help prevent diabetes. However, there are some symptoms of diabetes that can alert you that you may have the disease if you're not aware. And what are those symptoms? Well, increased thirst, increased urination, blurred vision, fatigue. So those are the signs that there are high sugar levels in your blood. And those are, some of the things that can make you aware that you may have diabetes. So if you're experiencing any of those signs, you need to go to your doctor so that your sugars can be checked, and also so that they can check your hemoglobin A1C. That's a 3-month average of your blood sugars. So again, those are some of the warning signs of that you may have diabetes, some of the early symptoms of diabetes. And definitely if you have a family history of diabetes, definitely the risk is even higher. So it's something that you need to check.
Yeah,
All
yeah,
right, great.
absolutely. We just got a question from the group chat, and the question says that what type of food? Good morning. I'm from New York. Yay! Thank you for chatting with us from New York. The question is, what type of food will affect thyroid medication?
All right. So, so I can take that. So thyroid medication. So thyroid medications can be given for an overactive thyroid or an underactive thyroid. So an underactive thyroid is called hypothyroidism, or your doctor may have told you that you have Hashimoto's disease. So an underactive thyroid is treated with levothyroxine, or the most common brand name is Synthroid. And Synthroid is usually given on an empty stomach, and it's given at least 30 minutes before meals. So for Synthroid, some of the things that can decrease the absorption in terms of food are like foods that are high in calcium or iron. Pills, the medications that can actually affect that are the pills that are high in calcium or iron. So if you're taking calcium pills, and sometimes people take calcium pills for osteoporosis or to prevent osteoporosis. So if you're taking a calcium pill or an iron pill because you have anemia, a low blood count, then that can affect your thyroid medication. It can affect the absorption. So you might end up getting less of the thyroid medication absorbed into your blood because of the calcium and the iron. So even just multivitamins that may have any of those things can affect it as well. And then sometimes people take like medications, like vitamins or other medications that may contain iodine. So any medication that actually contains iodine or any pill, any formulation of iodine can affect your thyroid medication absorption or use as well. The overactive thyroid is treated with methimazole most commonly and PTU in thyroid emergencies or pregnancy, and that has less interaction with medications. So the most commonly affected medications are the Synthroid. It can be affected by other medications. And again, it should be taken on an empty stomach. So thank you for that question. Great question.
Yes. Thank you, Dr. Hope, for that excellent answer. There is another person here from Florida. Yay. Thank you for coming in all the way from Florida. And the question is, good morning from Florida. A diet like keto, where carbs are limited, save long term?
All right. So keto diets. Keto diets, the reason it's called keto is because your body actually can go into ketoacidosis. So keto diets are diets that are very low in carbohydrates, low or no carbohydrates. So if you eat a diet that's low in carbohydrates, that could be okay. But if it gets to the point where there are zero carbohydrates in the long term, ketoacidosis may not be beneficial to your body. In the short term, I think, it can be okay, but for to have this in the long term, it's your body is actually going into a starvation mode, and you're releasing keto acids into the blood. So that definitely short term will be okay, but long term, definitely, if you're going to do something like that long term, you should definitely consult your doctor, your endocrinologist, and work closely with them to see if that is safe for you, especially if you have other medical problems like heart disease, and if you've had history of stroke or other disorders. So definitely that needs to be followed closely with a doctor. And personally, yeah, long term, I would say definitely consult a doctor. Short term, it may be okay.
Yeah, absolutely. Absolutely. There is another question here. It says, which I think I can answer this. It says, can thyroid level vary by age? And can a person with type 2 diabetes reverse it? So two different questions, thyroid level sure can vary by age. As you grow, your thyroid hormone, especially your TSH level, increases, but not significantly as well, because once it gets to above 10, we still consider you like you need to be treated if it is that high. But yes, your thyroid level can increase slightly by age. And can a person with type 2 diabetes reverse it? I like that word, reverse, because we often think, can we be cured completely from type 2 diabetes? You can go into remission